Welcome to Skin Conversations, a podcast brought to you by St John's DermAcademy, where we share stories about skin science and the doctors and individuals who shape dermatology.
DermAcademy is the educational hub of St John's Institute of Dermatology, which is internationally recognised for its clinical excellence, cutting-edge research and specialist training. DermAcademy was first created to meet the growing need for accessible, high-quality dermatology education, and we deliver evidence-based learning to healthcare professionals, patients and the public through face-to-face courses, online learning events and content. So we're your hosts,
Dr. Beibei
and Dr. Ali, and we're thrilled to introduce to you a brand new space where we explore the latest in dermatology, skin research, and patient-centred care.
Each episode will bring together leading clinical experts, patient voices, and academic dermatologists to uncover the science behind skin health and the stories that shape it.
So hi everyone, I'm Dr. Ali, a consultant dermatologist, and I'm also lead for digital education at St John's DermAcademy.
And I'm Dr. Beibei, also a dermatologist and skin researcher working as a clinical lecturer in dermatology. This podcast is our way of opening up the conversation from the laboratory to the clinic and, most importantly, to you. Whether you're someone with a skin condition, a healthcare professional, or just curious about the science of skin, you're in the right place. From eczema to acne, pigmentation to psoriasis, we'll dive deep into the conditions that affect millions and the research that's changing lives.
So we believe that by opening up these conversations about skin, we can empower our listeners with knowledge, debunk common myths about skin, and shine a light on the vital role of science in advancing skin health.
So wherever you get your podcasts, hit subscribe and join us in the skin conversation.
Hi everyone. So in this first episode, we thought we'd just give us a bit of background about ourselves. So Dr. Beibei, tell us what really sparked your interest in dermatology.
So I got interested in dermatology when I was at medical school, and I realised that I was really curious about medical specialties where there was a very strong diagnostic element to it. So I don't know whether did you ever watch House when you were?
Yes,
Yeah.
of course, yeah.
And you'd have all of these really fascinating medical mysteries, and you kind of put it all together like pieces of a puzzle. And I really think dermatology is a little bit like that.
Yeah.
You make clinical observations, you look at a patient, and you can somehow infer something just from examining their skin.
Yeah.
And if you look at medicine as a whole, we've lost that in so many specialties where the art of examining a patient and like looking at them leads us to a diagnosis. And in dermatology, we are still able to do that. Obviously, we are developing more ways in which we can understand skin better. But to me, that was really fascinating. And I loved being able to examine someone and come up with a diagnosis. And the correct diagnosis in dermatology is really what's most often needed to then make the right recommendation. And it's such a simple, at its core, it's so simple.
Yeah.
And you can make such a big impact.
Yeah. I share those sentiments completely. I love the problem-solving aspect of it. And I remember going to my first dermatology clinic as a medical student. And what I thought was really cool was using a dermatoscope and actually just looking. A magnoscope is just a special magnifying glass which shines polarized light through it. And by just looking at, pigmentation within the skin, certain sort of blood vessel patterns and other structures, we can diagnose things, much better than just by looking with the naked eye. So I thought that was really cool. And again, it's that sort of the fact that it's a visual speciality, I think is amazing.
Yeah. And I think dermatology attracts a lot of people who may have slightly artistic backgrounds because there is that visual literacy aspect, which can be quite innate as well.
Yeah.
The other thing which I love about dermatology is the procedural element as well. So I think the fact that we can treat skin cancers by cutting them out and making it look cosmetically pleasing and making a nice scar for a patient, that's really satisfying as well. So
it's really broad what we cover. It's medicine, it's surgery.
And also we have so many different diagnoses in dermatology. So we treat the full spectrum from birth to very, very elderly people, and we see everything. So skin cancer, inflammatory conditions, autoimmune conditions, absolutely everything. So it's really, really broad, and we so the learning is basically never ending.
Exactly.
Yeah.
Yeah. And is there a particular area of dermatology that you're really passionate about?
So I've taken a slightly unconventional route in my dermatology training. So I've spent 3 years doing a PhD. And during my PhD, I basically studied pores in very great detail. So my PhD was on the pilosebaceous unit
Yeah.
and how it functions in healthy skin and what happens when it goes wrong. And we have loads of conditions in dermatology where there are dysfunctional pilosebaceous units. And I remember as a dermatology SHO, that's like a very junior position within a specialty. As a dermatology SHO, I would come across these conditions which almost didn't have a proper name or a proper classification. And they would often be related to pilosebaceous unit dysfunction. And I was so fascinated by this that when it came to choosing what to study during my PhD, I thought I'd really like to learn about this more. And the diseases that I've focused on since my PhD are hidradenitis suppurativa and acne vulgaris. So acne is something that almost everyone experiences to a degree at some point in their lives. Obviously, it tends to be most severe and is most commonly found in adolescence when you have a sort of surge of hormones, which often triggers it in people. And, acne is essentially spots that appear on your face and sometimes your back and your chest as well. So that's something that a lot of people have heard of. And on the flip side, we have hidradenitis suppurativa or HS. And this is a condition that all dermatologists are very, very familiar with. It's one of the worst conditions that we encounter in dermatology. And it's a cousin of acne. So in HS, and this is a condition which is not even rare. It affects, we think, about 1% of the British population. In HS, people get recurrent boils, abscesses, sometimes even tunnels, and they tend to appear in sites like the armpits and the groins, buttocks, sometimes under the breasts, or in skin folds. So areas where there's friction or rubbing. And I saw a lot of patients with HS when I was looking after dermatology inpatients during my early training. And it is genuinely one of the most awful skin diseases to live with. It has such a huge impact physically, mentally, socially, in every way possible. And I was so struck by this that I thought I really want to, and the treatments that we have so far are just not good enough.
Yeah.
And there wasn't very much research in HS when I started my PhD. That is now changing for the better significantly. And but I thought this is, it would be amazing to apply some of the advanced scientific methods that are now available to study HS and try and advance our standing of a very complex disease that impacts so many people that we don't have enough treatments for yet, essentially. You have a slightly different sort of subspecialty interest in your dermatology. What is your sort of main focus with your clinical practice?
Yeah, so I mean, much of my background is in medical dermatology, and I did a fellowship in the area. But one of my particular areas of interest is photodermatology, which is basically looking at the role of how ultraviolet radiation can impact skin conditions. So whether it can trigger it or flare it up. So it's quite a niche speciality, but it's really important and has a huge role in skin conditions. One of the other things that's really close to my heart is a rare type of genetic disease, actually, which is called xeroderma pigmentosum. And along with another dermatologist called Hiva Fasihi, we run a national service for it at Guy's St Thomas's Hospital. And this is a condition whereby people are unable to repair DNA damage that's caused by ultraviolet radiation in their skin. It's a genetic disorder. It's inherited in an autosomal recessive way. So that means you have to inherit sort of one faulty gene from your mum, one faulty gene from your dad to be affected. So neither of them are necessarily affected themselves. And I think it's a really important condition. Actually, we've learned a huge amount about the role of UV radiation on the skin, because in these individuals, they're not able to repair damage to the DNA. So what we see is patients develop very easy sunburn. And this is not just your sort of sunburn after, spending the whole day out in the sun. This is severe blistering sunburn that's prolonged and can last up to 2 weeks. They develop lots of sun damage to their skin. So some patients you'll see lots of freckling over their skin in what we call a photodistribution. So that's just sites which are exposed to the sun. And then one of the things that we see as well is they develop a huge number of skin cancers from a very early age. And then finally, in a proportion of patients, it can also affect their nerves as well. So I think although it's a rare condition, actually by studying the disease in detail, we've learned a huge amount about the effects of UV on the skin and skin cancer development.
Yeah.
So for that reason, I think it's really important, and a disease that I like to highlight and make people aware of, especially because it's so important that we carry out more research. I think rare diseases can often be slightly ignored, especially these pharmaceutical companies obviously want to invest a lot of money into more common skin conditions, but it's some of these rare conditions can be relatively neglected.
And why the podcast, Ali? What's your
So
motivation for
this is
this?
something that so as part of my role in is teaching, and it's something that I've been actively involved in for quite some time now. And what we sat down and decided that we wanted to come up with a podcast that really kind of brought together patients' perspectives, leading clinical researchers and scientists together to really try and inform everyone who's interested in skin.
Yeah.
I know originally I had actually done a podcast which was just for healthcare professionals, and really wanted to make this more broad for everyone. So that's part of the reason why I've set up this podcast.
Yeah.
What about you, Beibei? What was it for you?
So, I mean, I've been doing some social media work for the past few years. And I'm a social media editor for the Journal of Investigative Dermatology as well. And I've seen firsthand by engaging with the public how good information is sometimes hard to come by. Nuanced information is hard to come by. And I think being an expert and being skin experts, we need to be bringing our voices to the table, because there is a lot of noise out there already, and we need to be engaging with the public. And I think science is so crucial, and understanding of science is so crucial to public health and public understanding of dermatology. And we are in such a privileged position working where we do, and spending time with the researchers that we do, and also with the patients that ultimately educate us.
Exactly.
And I think that there is an appetite and a desire for people from the public to learn more. And I think that it's an amazing opportunity to bring that in a more sort of unstructured format.
Yeah.
And these are conversations that we have all the time.
Yeah.
And I think it's just a great opportunity to share it with the public as well.
Yeah. So we've got a lot of, really fantastic speakers that we've got coming along to the podcast.
Yeah.
And, over the next few episodes, we're going to be sharing some of the, I guess, finest and brightest, clinical experts from St. John's, as well as our patients, which are really at the centre of our care.
Yeah.
One of the things that we also do as part of St. John's DermAcademy is, to make sure that the patient voice is heard. So we do lots of patient and public involvement events. So you can see on our YouTube channel, but also on our St. John's DermAcademy website, we've got lots of really informative webinars focusing on different skin conditions and problems that really kind of is there for patients to access if you want to, or everyone to access if you want to know a bit more information about it.
So Ali, I've got one question for you before we wrap up this introductory episode. What is the number one myth that you see about the skin, or that you hear patients talking about when it comes to skin?
So I think, when it comes to dermatology in general, I often feel that quite a lot of people think that it's just a cosmetic problem, and it's not particularly a serious subject. But actually, we know that day to day, what we see in dermatology is we're treating skin cancers, we're treating autoimmune skin conditions, which are really severe and have a huge impact on people's lives. And it's not a cosmetic problem. A lot of dermatology, it's very visual and it's hugely stigmatizing. So I guess my main thing is that actually it's really important. It's something that is hugely important to people. And
yeah, it has such skin has such an impact on people's lives. So and dermatology, obviously, it's not just skin either, it's skin, hair, and nails.
Yeah.
So things like, visible differences in the skin, hair loss, all have huge impacts on people's lives, their mental well-being, their ability to go about their daily lives and just engage with normal daily activities. And that's something that we hear from patients every single day. And we is not necessarily known about
Yeah.
by the general public. So we really hope that by bringing the patient voice to whatever podcasting platform you listen to your podcast, we can shine a light on all of that as well. To me, one of the biggest myths when it comes to dermatology is that there's one quick fix for a skin problem. I mean, occasionally there are. It's like if you have a skin cancer that can be cut out, fantastic. But, as someone who's more in medical dermatology, treating things like acne, HS, so many things in skin are multifactorial. And we are trying to address a skin manifestation of, maybe immune dysfunction or an interaction between the immune system and the environment.
Yeah.
And there's so many factors in play. There's not one single thing that is going to change everything at once. And there's a lot of complexity in there, which is why science is so important to give us the knowledge to address that complexity and give us the right tools to ultimately treat skin diseases more effectively. If you've made it this far, thank you very much for listening to Skin Conversations, and stay tuned for many more episodes where we talk everything about skin.